So the most common procedures that are performed are in number 1, LASIK, number 2, PRK, and number 3, SMILE. So PRK was actually the first procedure that was performed using the excimer laser, which made it much more accurate than when we're making incisions on the cornea and much safer. The problem with PRK is the recovery took a lot longer. It took almost a month for the prescription to stabilize, and there was a significant amount of discomfort for the patients. LASIK was developed in 1995, and what's great about LASIK is a flap is created. A flap is sort of like a lid, and we lift it up. It's still attached by a hinge. Then a different laser resurfaces the cornea, and then the lid is placed back, and that's LASIK. What's great is that it bypassed all the healing that was necessary, because in PRK, all the skin of the cornea, called the epithelium, is removed, and that has to grow back. All the corneal nerves are exposed, and that's why it was very, very painful. But with LASIK, we bypassed everything, and the results were pretty much instantaneous, and the recovery so quick that patients are just extremely happy. Now with SMILE, it's pretty much the same as LASIK, except there's just no flap. The incision is also much smaller. So a different laser actually just sits on the cornea. You can barely feel it because it's a low pressure system, and it creates a little disc. Basically, it's already pre-programmed. All the tissue that needs to be modified is already pre-programmed. And then through a very small incision, we just go in there and remove that tissue in one procedure, instead of having 2 separate procedures like the LASIK. Because the incision is smaller, there is a much faster recovery. There's very minimal disruption to the corneal nerves. The reason we feel dryness immediately after LASIK in some patients is because the corneal nerves are affected, and it takes some time for them to regenerate. It takes up to 6 months to a year for that to happen. During that time, we don't blink as much. When we're not blinking as much, we produce less tears. Plus, we're not blinking and coating the surface. So the eyes get dry, the vision can fluctuate, the eyes can get red and irritated. So that's the main reason why we kind of switched to SMILE, because of the advantages of less dryness symptoms immediately after the LASIK. The other advantages of SMILE include a little bit better night vision. When we treat a wider area, when the pupil gets large at night, more of the light goes through the treated cornea. So glare and halo is minimized. Finally, because there's no flap in the SMILE procedure, the cornea stays much stronger. By having a strong cornea, there's less chance of having side effects where it's a very rare side effect called keratoconus, where the cornea can get weakened from the procedure, or in patients that already have keratoconus, we can limit the effects of the procedure on their eyes.